Good morning, everyone. My name is Dr. Olaitan Abimbola of the Infectious Disease Unit of OUTH Shagamu. I'm here this morning to give us a sensitization talk on Lassa fever infection. As we know that in the country now we are having cases that are coming up day by day, and healthcare workers have been affected, and we have the mortality update as well involving the healthcare workers. In order to protect ourselves while trying to save the lives of our patients, we need this reminder very, very clearly. Lassa fever is an acute, infectious, extremely virulent zoonotic viral hemorrhagic fever. It was discovered in Nigeria, Borno State. The reservoir for this infection is the multimammate rat, as we all know. And during this season, the dry season, that is when the peak occurs, because in the wet seasons of May to November, the rat experiences its reproductive cycle, and many more of these offsprings are available. But during the dry season of the year, we find out that we go about our farming activity, trying to burn bushes, and all these ones that have been gathered together and increased during this wet season will start coming out in the dry season. So we need to protect ourselves from that reservoir. It's from where we get the infection, and we need to be aware of what can happen. You might think you're an healthcare worker. I'm not a farmer, I'm not going there, but we have contact with patients that are infected with this serious VHF. We need to have a very high index of suspicion. Number one, an important point I want us to hold on to is not all fevers is not malaria. It can be a viral hemorrhagic fever. We all know the signs and symptoms as fever, headache, malaise, fatigue, nausea, vomiting, diarrhea. When these patients come to the hospital setting, as healthcare workers, we come in contact with them. If you don't have a high index of suspicion, we can get contaminated, because just like it moves from the rodent, the infection is gotten from secretions, urine, feces, blood of the rodent to the affected individual. The same way, when patients with the infection comes to the hospital and we are not careful and we are exposed to their urine, their feces, vomiters, and their blood, we can get that infection by contact. Diagnosis is important. From the clinical investigation, our high index of suspicion, we need to do a specialized test. The disease notifying officer of the state must be informed if we have suspected cases. The patient must be isolated, and the lab should be alerted that there is an infectious disease case, that samples may be taken to the lab, and they need to protect themselves. Early diagnosis and treatment is very key for anybody infected, but infection prevention and control to avoid exposure is most important to the healthcare workers as well. This morning, our infectious disease experts will tell us more about the risk factors as well as the infection prevention control measures that we need to take. Thank you. No vaccine is available for VHF for now.
Good morning, everyone. My name is Nurse Obadino, the CNO in charge of infection prevention and control, OUTH Shagamu. I want to talk about the risk factors for Lassa fever. Poor environmental control. If your environment is so dirty, there's risk factor, there's risk of contacting Lassa fever, because the rodents coming from outside can get into your house. Poor housing standard. How do you build your house? You have holes that the rodents can come in through the holes. Deforestation. This time we have it's the planting season, and people burn bushes. These rodents can escape from the bush and get into your house through the holes that have been there. How do you store your food? The uncooked food should be stored in a bucket with a lid that is well covered, fitted. And the cooked food, the leftover should be kept in the fridge or freezer. Then this time we should desist from eating rodents, different types of animals, because you will not be able to really identify if it is a rodent or not. Then our cultural practice, when we are burying people, we should desist from washing corpses, touching corpses at this time because of the incident of Lassa fever. I want to talk about the prevention and control in the hospital. When there is a suspect, any suspect with the symptoms of Lassa fever, they should be isolated. The patient should be isolated, and we should not forget our standard precaution. Every patient is a suspect. Put on the personal protective equipment after you have done the risk assessment. You want to come in contact with blood or the body fluids, you should put on your gloves, your apron if there is going to be any splashes. Then you have your mask if you know that, or goggle if you know that there is going to be any splashes. Then hand washing is very, very crucial. Wash your hand. The 5 moments of WHO hand hygiene should be adhered to at this time. Then with disinfection and sterilization of every equipment, reusable equipment should be sterilized and disinfected appropriately. The standard precautions should be adhered to. Waste management, the steps in waste management, segregation into different bin liners should be done, and waste should be disposed appropriately. Then the cleaning of the hospital with hypochlorite is essential at this time, because you will not know when any splash get into the surfaces, and this transmission is contact transmission, so the environment should be kept clean, the patient's immediate environment, and even the hospital general environment. What of the community control? We have talked about the risk factors in the community, and so the community control also talked about rodent handling in the community. We should tell our people in the community that we should not at this time eat rodents, eat what we call ẹran ìgbẹ́ at this time. Then garbage control, when you are finished in the kitchen, all this your garbage should be kept outside and not inside, because they can, the rodents can trace all this garbage into your house. Safe burial practices is essential at this time also. You should not be washing the corpse, touching the corpse as we used to do because of the incident of Lassa fever. Then we can also have cats in our houses. Cats can serve as control measure for all these rodents. Thank you very much.